Did you know that a hidden electrical grid powers your heart? Welcome to Tomorrow's World Today. Your heart beats roughly 100,000 times every day. That's 35 million pulses of life a year. And for centuries, this spark, it was a mystery until the 1700s, when these pioneers, Galvani and Volta, discovered that biology and electricity were linked. They asked a question at that time that was going to take over 200 years to answer. If electricity was powering the heart, could we also use it to heal the heart? Well, it took until the early 1900s when Willem Einthoven first gave us the EKG. That was a map of the heart's rhythm, and we could finally visualize our electrical pathways. But for the next 50 years, we lacked a way to repair them without invasive surgery. So for decades, the standards were to use a big blade to make the cut, open heart surgery. Now that saved lives, but with recovery times up to a year, that toll's immense. So the process was innovated again in the 1980s when we moved from the blade to the catheter, using extreme heat or cold to cauterize and rewire the heart from the inside out. Today, though, we've reached a new frontier: pulsed electric fields. This technology doesn't burn or freeze. It uses ultra-rapid pulses that shoot holes into that problematic cell to kill it, leaving those healthy tissues unharmed. And the recovery time is near zero. Now, I'd like to learn more, so I'm going to send Greg to the world of innovation to show us how a pulse of energy is rewriting the human heartbeat. It might just be the most important discovery of our lifetime.
Heart disease is one of the most prevalent medical issues facing the world. In this episode, we'll explore contemporary and cutting-edge diagnostic and treatment technology in the world of cardiac medicine. But first, we're here at Duke University Medical Center. We'll meet with Dr. Jonathan Piccini and discuss some of the basics of heart health and one of the most common ailments facing cardiac patients today. Dr. Piccini, nice to meet you.
Nice to meet you.
Tell me about your role here at Duke Medicine.
Sure, I'm a professor of medicine here at Duke in the School of Medicine, and I also direct the cardiac electrophysiology program for the Duke Health System, which is the part of cardiac care that focuses on heart rhythm problems.
Okay, well, speaking about heart disease in a more broad sense, what's the impact worldwide right now?
I think most people are familiar with cardiac disease. It's the leading cause of death in the United States and across the world. More than 18 million people die of cardiovascular disease every year. And so people are familiar with many forms of it, including stroke and myocardial infarction and heart failure. But people are often less familiar with the heart disorders that affect the electrical system. And the most common, the disorder that affects more than 33 million people across the world, is an electrical disorder known as atrial fibrillation, which colloquially people refer to it as AFib.
And this is what you specialize in, and I'd really like to explore more about that.
Yeah, let's talk some more and learn some more.
So, doctor, you mentioned that AFib is very common. Exactly how common is it?
Yeah, it's so common that ultimately 1 in 4 Americans are going to develop atrial fibrillation at some point in their lifetime.
Does this affect people of all ages, or is it mostly older folks?
It's predominantly a disease of aging, so the older we get, the more common atrial fibrillation is.
What exactly is happening in the heart when AFib starts to present itself?
Yeah, so when the heart's functioning normally, there's an orderly progression of electrical activity through the heart, through the top chambers down to the bottom chambers. And when the heart goes into atrial fibrillation, instead of the electricity moving orderly through the top chambers, kind of becomes chaotic and completely erratic. And when that happens, those top chambers, the booster pumps of the heart, do not function normally.
Well, what are some of the symptoms that somebody might be experiencing that would lead them to believe that they have AFib?
Some individuals will experience their heart racing. Others will experience their heart skipping beats or pounding irregularly. Other individuals, because those top chambers are not functioning efficiently, will have a loss of energy or fatigue or difficulty exercising.
How does somebody know that that's coming from AFib and not some other disease?
A lot of those symptoms are nonspecific. So the way we make a diagnosis is we get an actual recording of the heart rhythm, because it is, after all, an electrical condition. Someone has those symptoms and they go to their doctor, they may get an EKG that shows AFib, or they may wear a monitor for several days or weeks that documents the atrial fibrillation. Other times people will have an irregular pulse, and that will lead to someone doing electrical investigation.
What are some of the treatments that are available now, and what are some of the innovations that are coming down the road?
So the American Heart Association and the Heart Rhythm Society really emphasize three key areas. One is reducing the risk factors and the problems that cause or perpetuate atrial fibrillation. Another is making sure people are prevented against stroke, because stroke can be a complication of atrial fibrillation. And then the third part of treating atrial fibrillation is helping people feel better. And that has several components. One is making sure that the heart rate doesn't race and get too high. Probably the most important these days is getting someone back into normal rhythm, getting them back into sinus rhythm. And there's a variety of tools we have at our disposal to do that. Sometimes we put a patient asleep and shock their heart back into normal rhythm. That's called a cardioversion. Other times we can treat patients with medications that help the heart stay in normal rhythm. But one of the most exciting developments is something called ablation, where we go into the heart and we target the areas that initiate and trigger and maintain atrial fibrillation, and we destroy those tiny areas of heart tissue.
All right, well, doctor, thank you very much. It's been great.
Thank you for visiting.
At Duke University Medical, we learned from Dr. Piccini about the basics of AFib, or atrial fibrillation. Now here at the Abbott Advanced Technology Center, we'll talk with Dr. Christopher Perkowski about the cutting-edge innovations being used to treat this very common heart condition. Christopher, let's talk about ablation and how that works as a therapy for atrial fibrillation.
Greg, this is an important question. In the United States, around 12 million patients are suffering from atrial fibrillation. Atrial fibrillation is an abnormality of the heart rhythm, and it has impact on quality of life, life expectancy, stroke risks, healthcare costs. So treating those patients is really, really important. Now, ablation in principle means destroying electrically unhealthy tissue. There is a close analogy to cancer treatment. In cancer treatment, physicians destroy the cancer tissue. In cardiac electrophysiology, the physicians try to eliminate the electrically unhealthy tissue. You can imagine that's not an easy task.
Yeah, when this all started, it was basically open heart surgery. So it was a very, very invasive procedure to have this done.
Correct. We are standing on the shoulders of surgeons. They taught us how to treat patients. Later, it transitioned into minimal invasive therapies that were introduced with a catheter over the groin into the heart. And the technological evolution happened around the energy sources. For 20 to 30 years, radiofrequency energy was the main energy source to destroy the electrically unhealthy tissue. And it has done a lot of good to patients. It has moved the field forward. However, right now, we are in a moment of big transition to a new energy source.
Pulsed field ablation, and that's what we're going to learn about today. I'm very excited.
Exactly. Pulsed field ablation is a new kid on the block, has a lot of promises. We in Abbott spend many, many resources to build pulsed field ablation catheters. I would like to show you one.
Excellent. Let's go see. Christopher, there are other pulsed field ablation systems out there. What makes Volt so unique?
I would put it into one word. Volt was designed purposefully from the ground up. The main purpose in the design was to improve the lesion quality. We have talked about how relevant lesions are for effective treatment of atrial fibrillation. And there are multiple single design elements that went into this concept. I would just want to highlight a few of them. You see the 8 splines of the catheter. These splines are flat and directing the energy into the tissue. Then comes the balloon. The balloon is, of course, a great tool for simplicity of handling and stability, etc. But it's also a great insulator. So it insulates the blood and pushes the energy into the tissue to create deeper lesions. It also protects the red blood cells from the energy field so that the energy field cannot destroy red blood cells. So all these elements contributed to the catheter design. Again, it was built from the ground up as a new concept, as a new catheter, and that's what we're seeing here.
So this is really revolution and not evolution.
Yes,
Well, I'd really love to see it in action.
let's go.
So, Christopher, this room is really impressive. Where are we?
It's a simulated EP lab where we train physicians, and like in a real environment, we have Lauren as a support team in the control room.
Great. Now, EP, electrophysiology, and that's basically the basis of Volt catheter system. So let's dive right in. Tell me all about it.
So we've talked about the simplicity of the design, which was intentional and built from the ground, and the ease of use component and the safety aspects. And I want to showcase this to you by handing the case over to you.
Okay, I'm ready.
What you see here is a hollow tube, a so-called sheath, sitting inside the left atrium. You can turn it a little bit to see how you can stare with it, advance it, pull it back. Inside is already the Volt catheter, and now I would ask you to advance the Volt catheter out of the sheath. Okay, stop right there. Inflate the balloon, please. You will see how the device goes up. Yeah, perfect. And now advance the whole system into the pulmonary vein gently. Perfect. You're sitting now in the left upper pulmonary vein. All electrodes have good tissue contact. Everything is blue. That's a perfect spot for ablation. And we initiate the first ablation.
The mapping is really incredible. This is really where the doctor is able to see exactly what's happening.
Oh, we spend so much effort to make this really accurate. How does it feel to manipulate?
It feels very simple. Every flash is actually the energy being applied to that vein.
Yes, exactly. Now the ablation is done, actually. You see the blue dots is where the little scars have been placed. Now I would like to ask you to rotate the catheter a little bit into the offset. Just rotate it gently. Pull it back if it's a little difficult. Perfect, you're there. And now keep it in between, keep the rotation on the catheter, and we do the second application. This is designed to have 2 applications to isolate the pulmonary veins. In clinical routine, we see 4 to 5 because pulmonary veins change in their size. But after that, you see like a continuous ring of little scars around the pulmonary vein. And that's the purpose of the therapy, to isolate the pulmonary vein with a little scar zone, because inside the pulmonary vein, is where the tissue sits that initiates the wrong electrical impulses that create atrial fibrillation.
So basically, all of those little scars are going to keep those errant electrical systems that are creating the arrhythmia from even reaching the vein.
Yeah, you jail them away.
Christopher, amazing technology. Thank you very much.
It has been a pleasure.
So far in this episode, we've learned about the basics of atrial fibrillation and the new cutting-edge technology, pulsed field ablation, being used to treat it. And now we're here at St. Bernard's Medical Center in Jonesboro, Arkansas. We're going to talk with a physician using this new technology in the real world. Let's head inside right now and talk with Dr. Devi Nair. Hi, Dr. Nair.
Well, hello.
Well, you are an electrophysiologist. Tell me a little bit about what that is.
So an electrophysiologist is an electrician for the heart. So when my patients think about the heart, they think about the plumbers who take care of the arteries. I take care of the electrical system, which keeps the heart in pace.
I've been learning about pulsed field ablation and how that's a relatively new technology that's being used to treat AFib. Tell me how that works for you.
So ablation is a technology that we have used for decades to take care of cardiac rhythm problems. Historically, when we used ablation, we've always used thermal energy. We've used heat or cold energy, which means we go into the heart, we find the erratic signal, we either freeze it away with cold or we burn it away with heat. The problem with thermal energy is that it causes collateral damage. Now, pulsed field ablation is a very new technology that delivers short bursts of electrical energy into the erratic area in the heart and destroys those abnormal tissues, which allows us to restore the heart's rhythm back, but without causing collateral damage.
Well, what are some of the other advantages for you as a physician and for your patients?
Number one for my patients has always been safety. Obviously for me as well, being able to deliver ablation strategies without having to worry about many of the older safety concerns that we had is big. The other thing that stands out is how quick these procedures are, which means the patients are not really under sedation or anesthesia for too long, which means their recovery is quicker. And most of my patients are actually back to living their normal lives within a few days, which is, I think, a huge advantage for the patients.
That's amazing. I would love to learn more about this.
Absolutely. Let me show you into the lab.
Doctor, this lab looks almost exactly like the simulation lab I was in with Dr. Bukowski. Now, when I got my hands on with Volt, we used a mapping screen like this, and it's amazing. But what is this?
Well, Greg, this is the lab that I work in, and these are images from a real case with the Volt PFA system that we recently did. So what you're seeing over there is an intracardiac echo, which is a camera inside the heart, which shows us how the Volt balloon is sitting inside the heart and in proximity or in touching the cardiac tissue, and how it integrates well with the mapping system. And this kind of gives me a very seamless workflow into delivering pulse field ablation.
Now, it's very easy to see exactly where the Volt is. That proximity to that cardiac tissue, how important is that?
One of the specific advantages of the Volt system is how it's a balloon-based technology that allows us to have very good proximity to the heart. So you can see on that image how that balloon is touching the heart tissue, which prevents destruction of red blood cells, which is very important in certain patients, especially patients who have kidney disease.
Now, you've talked a lot about the safety and efficiency of a system like Volt. What are some of the advantages that'll bring to treating AFib going forward?
AFib is a growing problem. It is probably one of the most common arrhythmias in the globe. And one of the things historically, we've waited for patients to fail a medication. And we've been very, very reactive in taking care of these patients. What I would envision for the future with technologies like Volt is that we're able to take this to the patients early on, be more proactive in their care, and get this therapy to the patients early on in their disease rather than wait till it progresses.
Well, Doctor, thank you very much. This has been great.
Absolutely.
Oh, hey, Dr. Tung. You're here. Welcome to Invention Land.
Good to see you again.
Good to see you as well. I was looking forward to you coming in because I've had some reflections lately. A really good friend of mine's wife had a heart situation and they found her in a bad way, but they got her back in order. And I was hoping you could talk with me a little bit about, what is the best way I should be living my life, or what's the best way to go forward and to keep good heart health?
This is the most common question that we get as cardiologists. And if you start with the basic, which is just avoidance of toxins, which not only is about cigarettes and alcohol, but sugars and refined carbohydrates and highly processed foods, those are toxins as well. But really there's this emphasis on cardiometabolic health and earlier detection. And when you think about conditions like atrial fibrillation, it runs with obesity, being overweight, where 2 out of 3 Americans are now overweight. So it's really being able to prevent some of that spiral that occurs with diabetes, obesity, and then inflammatory states. Atrial fibrillation used to be thought as just a nuisance, like, oh, I've got this irregular rhythm, oh, grandma used to live in that. But now we understand that it's a precursor to stroke. It increases the risk of stroke by 5, it increases the risk of heart failure by 3. So by being able to pick up on some electrical signals in the heart, we might be able to predict if these things could have been prevented, down the road.
So wearing a device, eating more healthily, getting outside, whole foods, that kind of thing. Okay, we can do a lot of that. I was hoping you could project as well, where are we going in the future in this field? Can you talk a little bit about tomorrow's world?
It will all be based on early detection and easier, safer therapies. So you can pick something up early, but if you can't do anything about it, it doesn't mean anything. And if you got a great therapy, but you got problems detecting it, doesn't mean anything. So they're really tied hand in hand. The early detection part, which is all the different watches that can pick up arrhythmias now.
Yes.
In the future, it will be on things that you and I didn't expect. It could be through facial recognition in a mirror. It could be on standing on a scale. So atrial fibrillation will be something that could be picked up in the wild and not in the office or in the hospital when it's too late. Then, if you have a therapy Something like ablation that we do now, which is just going with the vein of the leg, it's not surgical. And with pulse field, it's a lot safer and it's a lot faster. This is something that can be done as a day procedure in under an hour under some sedation. So by being able to quiet down atrial fibrillation or even eradicate it with a very minimally invasive therapy, that will move the needle for longevity, reduction of stroke, and heart failure.
That's amazing. Thank you for telling us a little more about Tomorrow's World. I really appreciate it. Well, that's another edition of Tomorrow's World Today. So we have some new medical devices that we're working on in Invention Land. I'd love to show you a few things. You good for that?
Would love it.
Come on, let's go down and we'll go into the lab. And remember, Tomorrow's World is where inspiration and creation drive innovation in production. See you next time.